I see Dave and Dwight and Joan. Looks like we have everybody. All right. Wonderful. Welcome everyone to the September Housing and Economic Development Committee meeting. I do not see, Katrina, any public comment. Have you gotten any?
Nothing.
Okay. I do not have any changes to the agenda myself. Did anyone else want to bring forward any changes to the agenda? Moving along. Minutes approval, August 27th, 2020. Can I have someone move those? Annie moves, Martha seconds, roll call. Annie?
Yes.
Martha?
Yes.
Mike?
Yes.
Henry?
Yes.
Wonderful. Those are unanimously, I'm raising my hand for approving those as well. Chair's report. I just wanted to give a quick update, a minute or two, about all the work that's been happening on the broadband front. I have sent to you all in the last couple of days extensive information. So I hope you have all had a chance to read it on the legislature. And for anyone who has not been privy to those emails, I have been working with Kurt from Tompkins County Area Development, as well as Katie Borgella from our commissioner of the Department of Planning and Sustainability on the exploration for regional municipal broadband. Some of the things that we have been discovering, of course, obviously during COVID, in addition to a tremendous need for childcare, more stable housing, you name it, helping us get back to work, is highlighting the need for broadband. And universal broadband, or more importantly, broadband into rural areas where we currently do not have it. Some of the things we've been specifically discussing is the need for extensive evaluation of where all the gaps are. If we were going to extend out, particularly municipally, what would be the right approach, whether it be individual municipalities, or would it be county, or would it be regional? And there is a nonprofit called the Southern Tier Network that we have talked about here. So we are continuing that conversation. And several of us have met with Southern Tier Network to get a sense of what it is and what they're offering, what they're currently doing. So it is currently officially a 5-county nonprofit, municipally owned nonprofit. So all counties of those 5 counties are represented on the board, and they have been building out middle mile. So that is the fiber that is sort of the backbone of a network of broadband. And recently they did a study to explore what it would be like to do a significant build out of both that middle mile as well as last mile directly to commercial properties and residential properties. The study included what would be the financial model, what would be the business model, what would be the engineering design, a pretty extensive study that they did across 5 counties. So I have asked them to present and connected them with our Tompkins County Council of Governments, because there are many municipalities, if not all of the municipalities in Tompkins County, that have been exploring this issue. I've heard from many elected officials that they have been hearing from constituents pretty harrowing situations, children not able to go to school from home, but have to sit in parking lots, people who have to sit in parking lots to do their work, to get broadband because everything is virtual. So many of the municipalities in the county have been exploring it on their own. And I wanted to bring STN to connect with all the municipalities to show an additional option that is available, which is connecting with this existing nonprofit to join in with their regional approach, which does bring in economies of scale, a significant increase in bargaining power with the internet service providers that would still, by the way, provide the service through the wires. But the idea is potentially that the wires themselves could be municipally owned. And that is what they do. They've been doing it since 2011. That presentation is tomorrow at 9 o'clock to the Tompkins County Council of Governments for anybody watching, anybody who wants to attend, and all legislators. I highly encourage attending. It's very interesting information, and we'll explore from there. I did connect with all of you that I am interested in putting together an over target request that would be a one-time, specifically to extend that study into Tompkins County, because we can't really address our broadband issue if we don't know the extent of the problem. So that is something that I'm exploring. Once it's finalized, of course, I will share it. But any input and thoughts and questions, please do share them. And that is the full chair's report of what's been happening between meetings. So if there are no questions about that, I will move on to committee member reports. Any reports from any of the committee members? Henry, I see that the boxes around your image. I'm not sure if that was because you were briefly talking.
Oh, no, I'm not talking.
Okay, so county administrators report.
Good morning, everyone. Brief updates just from really from the meeting I just had with the local elected officials. Kind of speaking of K through 12, biggest challenges we've seen so far is the inconsistency of guidance from the New York State Department of Health and the New York State Department of Education about children having to go back to school and what happens when they have you know, a runny nose, which happens weekly with children. So they then at this stage of the game have to get a COVID test, have to wait for a negative result, have to wait for symptoms to reside. Although folks with multiple children who may not be symptomatic can now go back to school, even though they're not, as long as the test is negative. But that has created a lot of confusion over the past week, which Frank is trying to manage because there is not clear, consistent direction from the state. And then trying to articulate unclear information to superintendents and nurses, which then doesn't work its way out to parents easily, has been a challenge. So they're working through that now to try to get it to a place that's going to be safe and clear and that everyone can implement. That's kind of been the last week of challenges with that, and personally having to go through it where I've had to take 2 of my 3 children to get a test. I don't know what's more traumatic, them or us having to hold them down to get it done. But nonetheless, we're hoping that it can be resolved shortly. That's probably the biggest movement or changes with COVID. Prevalence of the disease remains low. Cornell is doing a great job with its surveillance testing. Very low, under 1% in terms of prevalence in the community. There's a Good Morning America clip, which I think you all saw, which I thought was very positive. They're now preparing for a safe exit in November of everyone, and then will be preparing for a safe reentry in the late winter. So I mean, that's where I think their planning shifting is moving to right now. So so far so good. I think whatever we saw a few weeks ago has been leveled out right now. We don't see any surges or anything or any clusters popping up. Students seem to be responding well. Enforcement data is fairly low right now. We've only had like 1 violation last week with a few instances. So we're going to talk with the sheriff's office about maybe backing off some of those extra details if we don't need to do them because it doesn't seem to be a need right now. So we're going to have some of those conversations over the next week or so and make a decision probably in the next week or 2 about whether or not we need to continue to have extra patrols on in the city. Other than that, I don't know that I have anything specific for HED matters right now.
Any questions? Martha?
Yeah, just wondered, that's good news, Jason, and I saw Amy sent out the statistics, so I didn't get a chance to look yet. On law enforcement, I guess I would caution that 1 week isn't quite a trend yet. So
now it's been going down. That's, we kind of figured we'd go till the end of September and then go and evaluate from there. And it's trending in a downward trend. I mean, I would expect it'll pick up again when the time comes to go home for a week, prior to that.
All right, and something we can add back quickly if we have to, right?
Yeah.
Okay. All right, thanks.
Annie?
Thank you. Jason, is there any progress on a saliva test for COVID?
I think that's several weeks out. That's what Frank talked about this morning and the elected officials call. They still have to get the test certified. It's not the right, validated. That's the word, validated. I assume. So I don't know all the details to it, but that question was asked, is it days, weeks, months, years away? And he said it's probably several weeks away. So that would definitely make it easier for K through 12 issues, because it's impossible, for children to do it. It's a difficult process for adults, let alone for children. So I think it's weeks away. That's what Frank's last kind of, they're working at it. And, and I know he's involved in those conversations, but they have to go through some type of validation process. And I don't know exactly who validates it, but it's some federal agency.
Okay, thank you. I would imagine it would be much easier to get kids to spit rather than something jammed up their nose. Thank you.
I would agree with that. Yes.
And Martha,
I can't afford to keep doing it, because every time we go, we have to give them a treat. We'd like get them a gift, bribe them to go. So I just can't continue to do it. Like, Target is getting its fair share of Barbies and Legos being purchased from my pocketbook because my kids are getting tested. So.
Well, and that's why we got to fix this. That's
that I told Frank, if there's a priority, it's this. I cannot afford to do this anymore. I'm sorry.
We'll talk about the Barbies offline.
Yeah.
I was thinking the same thing. We can come up with some alternatives. Martha, you had brought up a question earlier today that I really appreciated. I don't know if you want to bring it online here, specifically about getting prepared for any vaccines.
Yeah, and I don't know if people saw that. I emailed last night about a NACO, National Association of Counties call I was on, and they were talking about preparation for distribution of vaccine. And I was thinking like, later. And they're like, no, here are some of the things you'd need, like freezers that go to minus 70 degrees and where, figuring out prioritization, who gets them first, how you do this. I think 5 of the 6 vaccines under development now require 2 doses. So there are all these major logistical issues, and people have to get the second dose from the same company as they got the first dose. So suddenly I had a heart attack, wrote to Frank and copied y'all, so we do really need to start thinking about this, right? And he wrote back and said, we've had these kind of plans for 10 years. We have these kind of freezers. Kuga Medical has, vaccine freezers as well. So that made me feel like, okay. I don't know what we do need to do. I understand the state really has to develop the plan, and then they tell us what we do. I don't think prioritization is up to us in any way, but that could be a question. The other question really was about, want to make sure we have a downtown site, and there just has to be at least one walkable downtown site, period, full stop. So when this starts to happen, so if that's a conversation we ought to start having now, then I just want to raise that.
So we every other year go through training exercises, and there's a series of staff that have certain roles in the pod distribution. So they are located across the county and how they distribute these vaccines. And you have staff that volunteer and go through these training exercises. I want to say it's every other year. Megan's nodding her head. I think she's, yeah. I don't know if you're a part of it, but there's a set plan, and there's a trained staff that know how to administer, know how to regulate. I mean, the preference is not in terms of priority is not anything we would weigh in on, but how we distribute them is something that we're very equipped to know how to do. In fact, it's probably, the original setup of the site up in Lansing was really modeled after the expertise we have in the health department in setting up these pods. It's a very similar process where people are able to get through it. So there's agreements in place anywhere from locations, storage facilities, those types of things to be able to handle and execute a distribution when the time comes. So it's something I think we feel very comfortable in doing when the time comes to do it because we've had practice at it. And there's a series of staff that are that are qualified to do it because they go through the training exercises every year, every other year. I don't remember exactly, but I know they go through an actual, not more than a tabletop, an actual exercise of doing it. Pat Buchel actually used to be very involved with it too. I know we're comfortable with it and we'll be prepared for it when the time comes.
So you mean Megan might be giving me a shot? Is that what you
I
mean?
don't know if it's Meg. I don't think they're giving any shots. I think the nurses are the ones that do that, but there's a lot of logistical staff that goes behind, making it happen. Anywhere from receiving pallets of the vaccine to being forklift drivers to putting it, all of that has to happen to administratively processing people. So I have not been involved in it. I know it goes on. But I know Frank and his team have gone through these exercises before, and there's a lot of county employee participation.
Can we be assured that there's at least one downtown site?
I don't know if there is a downtown site, Martha. I know there's predetermined sites and for logistical reasons. I do know though that if there is a need, I think Frank mentioned his email, this is not about transporting sick people. So the ability to transport people and partnering with TCAT to do so is going to be a lot easier than trying to create a site that may not be part of the existing plan. So if there is a need to transport people because they don't have transportation, we can make arrangements with TCAT, collaborating with them or Gadabout or whoever the case may be to ensure that people have means to get to and from to get their vaccines. So I mean,
I'm sorry to belabor this, but prior to getting the vaccine, it's like it is right now, where everybody is vulnerable to the virus. I don't see as transparent.
The only thing I can tell you with this is that we've gone through this process, so we know how to administer it. And if there's a problem that comes up in it, they'll be able to work out a solution when the time comes for it. Ensuring that there's access for everyone that needs to get access to it. The location of the actual pod distribution is not as important as ensuring that we can get people to it as safely as we can. That I will leave up to the public health officials to determine how they go about doing that.
Just to move on, we don't actually know where all those sites are, so maybe we can continue the conversation. Jason, that's something you can share with us.
Sure.
But I appreciate the priority of the safety piece, so thank you. So moving on to housing. We have a resolution authorization to amend 2015 Memorandum of Understanding with the City of Ithaca and Cornell University to administer the Community Housing Development Fund. That's ID 9575. Can I have someone move that? Martha, and seconded by Annie. All right, that is officially on the table, and we have both Megan and David here. Either one of you, if you want to talk about this and the three details of the adjustment, that would be great.
Sure. So I'll start with this and Megan jump in if you see me miss anything. This is a pretty simple resolution. Some of you may remember that you passed authorization to amend the MOU earlier this year. That included the ability to accept new partners into the deal, as well as accept new funds from groups that didn't want to give enough to become an associate member, and a process for that. So that was approved shortly before COVID. Because of COVID, it didn't get ratified by the City of Ithaca and Cornell. And in the interim, we have had the creation of the IDA's new policy that would have developers donate to this fund in lieu of building some affordable units themselves. So we wanted to roll that change into the MOU amendment. So we have one clean amendment that covers all of those bases and would allow us to accept those funds and work with them moving forward. Are there any questions about that?
I do not. Does anyone else have any questions? This has been very smoothly run for years, and I very much appreciate all of your work, Martha. Your work to get others involved, other communities engaged with this is super important. David and Megan, you have worked for years to streamline this and make it as understandable as possible. A situation I think that is a Herculean feat in this particular juggle. So thank you. And if there are no questions or comments, I'm going to move to a vote. Martha?
Yes.
Annie?
Yes.
Henry?
Yes.
Mike?
Yes.
And I am a yes, so that is unanimous. Moving on, we have a budget adjustment for Community Development Block Grant Healthy Homes Rehabilitation Program, and that is ID 9574. Can I have someone move that? That is Martha who's moving it. Can I have a second? Mike seconds. Great. It is on the floor. Would you like to explain this one, Megan or David?
Yeah, I'll take this one again. And it's pretty simple. We accepted this grant last spring. This just moves the money into this year's budget where we've been spending it. And we'll do this again with whatever's remaining for the 2021 budget. This is the program that is funding the emergency rental assistance program, as well as funding the low-income homeowner rehab program.
And David, could you talk to us a little bit about how much money was ultimately used? If I recall a previous presentation, money was used in this. We got permission as it's written in the agenda to use this for emergency funding for people who had been negatively affected by COVID to help pay rent. Can you give us an update on how much money ultimately was used for that program? And if I understand correctly, that program was closed and the money has been moved back into rehabilitation because that is possible now, or am I misremembering?
It's not exactly. That's going to be in Katie's commissioner's report, all the details, but the short answer is it's approximately 50-50 right now between rental assistance and homeowner rehab. So we basically had the rental assistance demand was low enough that it made sense to put some back into rehab. And we still have room to, I think, triple the number of people who receive rental assistance over the number that's in the program right now, in addition to funding more than a dozen home rehab projects during the grant period. So we're just reallocating some of the funding since we can start doing rehab again, but still keeping plenty of money in for ongoing rental assistance. And I don't want to steal all the thunder of the commissioner's report, but also we found that the per month or per household cost for the rental assistance was lower than we expected in our model that we were estimating how many households we can cover. So actually reducing the amount of funding reduces the number of households we can serve less than we would have expected. And that's partially because some households are only needing assistance for 2 months. They can get up to 3, but if someone's out of work at the beginning of the period, but then they go back to work before the 3rd month, they only need the assistance for 2 months. And also a lot of the households that were being assisted have rents that were just lower than we expected because they're in a low-income housing already and the prices are otherwise subsidized. So, some households we are subsidizing, their rent was $600 a month and we estimated the average would be $1,200 a month.
Wonderful. One last question for this. What percentage of the people who applied have actually qualified?
Let me see. That's again going to be in, we have the exact numbers in Katie's report that I don't have in front of me right now.
Okay, I think Megan is going to be giving us that report, so I will move on to that, which we are getting closer. Martha.
Thanks. So do you have, am I muted?
No, we can hear you.
Okay. Do you have people in the pipeline? Is there any people don't know about the program? Is it worth putting out another press release? I had somebody, contact me about one of their tenants, and then I sort of, sent them the information. Is there, I'm concerned that there are people out there who just don't know that, who might qualify and really have a need and just don't know about it.
Sure. I think INHS has definitely gone above and beyond the normal amount of advertising for a program like this. Every little bit more helps. We want to make sure that everyone who qualifies for the program does get in. And I actually just pulled up the numbers since we're talking about it. It's about half of people who have applied have been eligible. And there's a lot of reasons that people end up being ineligible, whether it's because their income's too high or they have assets that they would be required to spend before they qualified for the program, or they just never complete getting all of their information in, which is a problem for some people. They kind of start the application and don't finish it. So I think right now we're sitting at 36 of 71 applicants in the county had been ineligible for the funding based on the requirements. And I would note that we worked hard to keep the requirements as minimal as possible, just doing what the state funders required. And they also express an interest in keeping everything as minimal as possible. But there are requirements. There is an income limit, there is an asset limit. And
I think we can reach out to Dominic as well to see if there's another kind of county push on advertising and when the timing might be good for that to keep it out there for folks. I'll say the other piece in terms of the rehab is recognizing that as much as we wish that people that will be struggling for more than 3 months, that we could help them more than those 3 months. Unfortunately, you're not able to do that with CDBG funds. So we won't have the same people coming back for assistance because the regulations don't allow that. So it would be only new applicants that would increase our pool.
I see. All right. And the Human Services listserv, of course, is always a good place to push that out. People may have forgotten that it's still available or assume that the money is gone.
Mm-hmm.
Thanks.
I've seen it put out there regularly, actually, for several weeks in a row. I've been putting it in my daily summaries, and it's one thing that I expected to get feedback on, and I've gotten no questions, follow-up questions, but I do see it regularly at Human Services Coalition. Dominic puts it in.
Yeah, and it is a little confusing that we have a program, New York State has a program, TC Action has a program. There's a lot of stuff going on, and I think there's been some confusion with the cancel rent advocacy as well, that a lot of the news about this program gets mixed up with that and the other program. So I think we're trying to really clarify for people and just encourage people to call and talk to INHS if they have any questions or any interest in it, and they can help guide people in the right direction.
Thank you so much, David. It's a tremendous amount of work. Moving on to Planning and Sustainability Department additional. We have another resolution, and I'm so glad to see that Joan is here because I am hoping you can translate this to English for us all.
Yeah, sorry about that.
No. I mean, you wrote it in the language that is appropriate to write it. I just need a translation. So, adoption of Section 3 Participation Plan and designation of Section 3 Officer, ID 9570. Can I have someone move that? It's Martha, seconded by Annie. All right, Joan, floor is yours.
Okay, the federal law that guides the use of money through the Department of Housing and Urban Development, like our community development block grant programs, requires that certain kinds of activities, let me step back. Let's rather than require, what the intent is when a community is spending housing funds from the federal government, is to try to the extent that they can to hire businesses that are low-income businesses, or to hire individuals to work on the project who are low-income individuals. And particularly if they're if a project is, for example, in a low-income housing project, to actually hire people who live in that project. So this really applies more for gigantic projects in big cities because the triggering levels are relatively high. So if you get a grant of more than $200,000, which we do regularly, we are subject to Section 3. But what's subject to it is if we hire anybody specifically to run the program, which we do not do because we use existing staff. If we hire contractors to do work, and their contract is more than $100,000, then Section 3 is triggered. So the only contracts we've ever had that exceed $100,000 are our administrative contracts with INHS, or before that, they would be subject to the Section 3 requirements. And again, if they hire people specifically to work on the program, they have to go through this effort, the Section 3 plan, or if they hire contractors in the amount greater than $100,000, they have to follow Section 3. Well, they never hire contractors for $100,000 worth of work. We do housing rehab. Yeah, it's in the $10,000 range, not the $100,000 range. So this really kind of passes through to INHS in our example. But it's worth noting that if another department were to get community development block grants or other housing funds from the federal government, they would also need to comply with Section 3. It's not just the planning department, it's the county as a whole. So we're required to have what's called a Section 3 participation plan. Thank God that the city has already gone through this, and I really want to thank them for sharing their plan with us. And we were really able to take what they did. We checked all the boxes you need to check, have an acceptable plan. So we were able to use that to develop our plan, which is almost identical to theirs, except where you have to say county instead of city, and context, all like that. So I do want to note that the recently adopted update to the county's procurement policy referenced having a Section 3 participation plan. So prior to that, this was kind of like at the staff level that we developed this plan like last year. But since it's in that policy, we kind of thought it'd be a good idea for the legislature to adopt the plan, just so no one questions whether it's really a county plan versus just something we stuck in a file somewhere. That's
Great.
a long explanation. I'm sorry.
No, that's wonderful. I understood more than I thought. The one thing that was confusing to me is whether or not this was a requirement just for the county, whether government, whether it was across the county, who was doing enforcement, and you clarified that, so I appreciate it. I don't know if anyone else had any other questions about this. It was very detailed, so Martha?
Yeah, are you not able to see the hands up? As I want two questions, Joan. Does this apply to community housing development fund projects? Where we're giving money to other, to other entities.
Using
That
CDBG.
is an excellent question, and I don't know the answer off the top of my head. I would have to dig into that a little bit, because we're not contracting for work the same way we are. I'm gonna just glance at Megan to see if she wants to say something. She does.
Yeah, I'll say because for each of the two MOUs for Community Housing Development Fund, we've coordinated with the HUD field office. And so although I'll say they haven't explicitly said ignore Section 3, they haven't required any reporting because they understood our program as, making a grant to try to leverage other funds to make development happen, but that we're not per se like contracting with somebody to hire the people to build the project and trying to deal with those ratios of things. I'll also note that, as Jones pointed out, this works much better, and HUD tends to focus on its entitlement communities, which tend to be large metropolitan areas, where they may be running job training programs for public housing residents to teach people, plumbing skills or things that could be used. And they're also able to use CDBG money in ways that non-entitlement communities like us can't. And that's why this is always felt a little bit odd, given that we're pretty limited in the types of work that we can do and what contracting is likely to happen. So the intent is great. It's one of those things that the execution doesn't necessarily match well in every community.
Mhm. Thanks, Megan. And what's the, it says low and very low income persons. Do you happen to know what the AMI is?
There's an attachment at the end of the plan. Let me pull that up. And because it's based on family size and whatnot. Sorry.
I don't think we have that. I look for it.
It's on, well, in the PDF, it's page 17. So it's the penultimate page in the participation plan. Can I say P again? So it ranges a one-person household of $47,000 would be 80% of median income. And for 8 persons or more, 88,600. You can see that.
That's 80% of AMI. We didn't get paid up to page 17. So,
Oh,
right.
you didn't? I'm sorry.
It's not in the printed packet anyway.
You should have 18 pages in the actual participation plan.
I see 10.
We have 10, yeah, 9, 10.
Oh, maybe you didn't get the attachments. So my apologies. The attachments are, well, they're not really integral to the plan, but it's the forms that people would need to fill out if we were following up on this. So there's application to be a certification as a Section 3 resident, certification for a Section 3 business, the income limits, which change every year as HUD updates theirs, and then the standard Section 3 contract clause is also attached, which we already put in our contracts.
That might be an electronic version, but it didn't come in the mail. So, all right, that's great.
Okay.
Yeah,
I'll be trying to save some printing costs. It's not that much, but
that's fine.
Would you like me to email that to you directly, Martha?
No, that's okay.
Okay, thank you.
Thanks. Okay.
The only form is the Section 3 participation plan for Section 3 covered contracts and its signatures. It's a certification page.
Mhm.
Oh, yeah, that's part of the plan. The attachments are the forms for people who are, if this ever gets triggered locally, what forms we would have to have available. Because it does happen in the city, so they have the forms.
Yeah. It's only to page 10 on electronic form.
Okay, my
Thank you, Becky.
apologies. Maybe I uploaded the wrong version. I don't think I have a version that only has 10 pages, but.
I don't think it changes the essence of what it is that you are asking for. It would, and we can all go to the electronic copies. It's fine.
It's administrative forms and things. It's nothing substantive.
That's fine.
Wonderful.
Thanks very much, Joan. Okay.
Unless there are any other questions, I want to take a vote on this and move to the commissioner's report. So Martha?
Yes.
Annie?
Yes.
Henry?
Yes.
Mike?
Yes.
I got you, Henry.
Yes.
Thanks, Mike. Wonderful. That is unanimous, Joan. Thank you so much for your work,
Okay.
and a shout out to the city. Thank you so much.
Yep. Thank you so much for your time and the work on this. We'll see you later.
Take care, Joan.
Bye-bye.
All right, Megan.
Yeah, Katie sends her apologies, but I'm going to step in today on her behalf. And honestly, we don't have too much for this committee, apart from the rental assistance update, which David had started, mentioning that we're up to the 71 applications for the county portion of the funds so far, and that 36 of those applications, unfortunately, have been ineligible so far. I know you've been curious since the city also has funds kind of running a program in parallel for those within the city limits. And so they're at 54 applications, 27 of which have been ineligible so far. And so we've got 19 households that are already receiving payments through the program, through the county's portion of the funds. 18 of which have received the full 3 months. And so they're basically at the end of their assistance. And as I mentioned earlier, unfortunately, we can't extend the assistance beyond the 3-month period. I will note that there has been a lot of coordination. We often are a New York State guinea pig for many things. And in this case, since we were, first out the gate trying to do this rental assistance, as we started to talk with DSS and others that are running, that work with housing assistance in the community, there's a lot of behind the scenes coordination so that there's no wrong door if somebody is reaching out for help, and that we try to direct people to the program that's going to best benefit their household. And in some cases that won't be this one. So they may end up in a DSS program or some of the others that David mentioned. So there's a lot of coordination behind the scenes as well to make sure the household gets the best assistance we can provide. And as David also mentioned, the cost has been less than we were expecting, but the program remains open. We want to keep that message going. So we'll keep pushing that message out in case there's anybody that's experiencing new income loss or things along the way. It's been, I think there's been an unexpected, at least in the early months of the pandemic, across the country, it was unexpected how many people were able to make rent and how hard people were, trying to juggle everything to keep up with their rental payments. I think speaking to the importance of a safe home, especially at this time. But we'll keep word out there. So if there's anybody else that we can help, we can keep going with that. And so then as you just acted on, taking some of this money back into rehab will allow us to be serving low-income homeowners as well during this period. That work takes a good amount of time. So having that money, this was our best guesstimate of what the need, and kind of making sure that we were keeping money in rental as well as money in rehab for homeowners. I would anticipate that we'll likely need another budget adjustment towards the end of the grant period as we figure out in detail if we start to run short on one side or the other, and one side's not going to be spending down all of its funds. This was basically our best estimate working with INHS at this point. So are there any questions on that part? Okay. Then the only other thing I wanted to mention is, like many county departments, we've been trying to assist as public health has been working very hard with all of the contact tracing and quarantine calls and things that they've been doing. And so we actually have 4 planning staff members that have been trained in contact tracing and quarantine checks at this point. And so we've got them working on a rotating basis, basically 2 weeks at a time, so that we can try to make sure everybody's other work program items keep rolling, but that we also have a number of staff ready, especially if winter becomes difficult, recognizing the tremendous amount of work the health department has been doing. So everybody remains available. David is actually on tap right now. That's why he stepped off the call, but he's been making many happy calls as he's able to release people from their quarantines. So you shouldn't ever get somebody is missing entirely, but we're all just kind of covering for each other behind the scenes as somebody takes on some of those calls and things for a period of time.
Wonderful. Thank you, Megan. And please pass our thanks on to the entire department for going above and beyond always. Henry, are you okay?
Yes.
Okay. Did anybody have any questions for Megan? I don't see any hands. I did want to note Katie does sit. There are 3 liaison appointments to the Southern Tier 8. This is finishing our 3rd year. And as many of you know, it does allow us to be eligible for ARC grant funding. That's federal funding, of which we have had multiple applications every year to wonderful success. So I just wanted to give a nod to Katie, who is on the review board for ST8 for the art grants. It's one of those unspoken, or unsung things that she does for the county, and she does put a lot of work into it. So I just wanted to note that. There have been extensive conversations about broadband for years, and it's actually through ST8 that Katie and I got in touch with STN. That was actually a thought from Jen Gregory, who has been doing this work for over 10 years herself. So I did want to note to how helpful ST8 has been to the county on many fronts. So thank you, Megan, for the report, and please send our regards to Katie. And I want to move on to the last department in the Planning and Sustainability Department, tourism. We have Nick here. If you want to give us your report summary.
Sure. Thanks, Anna.
Absolutely.
Yeah. So in your packet, you should have a summary for the August and September tourism program update. A few items of interest just to bring everybody up to speed on. So back in August, the STPB did complete a recommendation for a 2021 budget. However, shortly after that, we received some information regarding the hotel occupancy and performance in July. This is the Smith Travel Reports, which are typically released around the third week of the month. That caused me to sort of ring some bells and say we need to have a look at this, and ultimately led to a staff decision to amend that budget prior to its inclusion in the full county budget. So this is sort of an unprecedented situation, at least in my understanding of it. And we're constantly monitoring the hotel performance, and unfortunately, it's been lagging behind where we had hoped it would be in 2020. And if that trend continues, we're going to be facing a pretty severe budget shortfall by the end of the year. Which brings me to the second bullet point, which is that we're informing everybody who has an existing a contract with the tourism program that fourth quarter payments may be withheld up to 100% until our full 2020 room tax can be collected. We're going to do an analysis of this in early October when we get our third quarter room tax report in from finance, looking carefully at those numbers and looking ahead at what we see on the horizon for the next few months to make a determination of what will be responsible for us to release at that time for final annual payments. So we're working closely with our partners on that. There's a typo in the third paragraph here. The delinquent payment report is current as of September 11, not July 8th. It's getting better. This is the good news. A few more hotels are catching up on their payments, but there are still a few lagging out there. I think we were at 7 in the second quarter and 4 from the first quarter. From our last meeting, one of the things we had talked about was the recommendation to move the room tax for our small lodging properties up to 5%. So we have a consistent 5% across the board. We, following some communication on that meeting, decided to do a survey to that audience to see their feelings about it. That survey is currently open. We've got about 20 responses, and we'll be collecting more responses here through the next week or so. And then the final item I'd like to mention is the ACOD grants for 2021. We just opened the grant cycle for that program here, and are accepting the first part of that application, which is basically an eligibility checklist. So organizations that are current or prospective ACOD awardees can go ahead and get started and begin to fill out the application. The final applications won't be due until mid-December. Happy to answer any questions about that process or any other things I just talked about for this group.
I have a bunch of questions, but I'll take from the committee first. Martha, I see your hand.
Thanks, Anna. Thank you, Nick. I'm looking at, so this long list of year-to-date funding by organization. That's really helpful and pretty scary. Are these numbers like everything that an organization might have gotten, like capital as well as ongoing, program support?
Yeah, this is just dollar amounts. It's not, we don't filter out any, by, different projects or things like that. It is the budgeted amount. So this is not, this is not like what you would get out of an accounting software that would tell you, how much actual money has been dispersed. This is from the budget, not from an accounting report.
Okay, but the fact that it may include a request for a big capital thing or a one-time initiative one year and not another year. So that's why one reason there's so many fluctuations.
Right. I think there's some good examples of that. If you go down to page 2 and look at like the Friends of Stewart Park line, they've been successful in the last couple of years of getting capital funding. However, this year when that program was suspended, no funding was awarded. Not that it necessarily would have gone to that organization anyway, but that's one example.
Right. And then on the next page, we've got the room tax report. So looking at Q1, so Q2, look at the B&Bs like really dropped off a cliff in the second quarter. In the first quarter, they had actually gone up, whereas the hotels went down in the first quarter. So that's kind of interesting. I mean, I'm just looking at these, at the relative trends. So they both went off a cliff in the second quarter, of course. When will we get the third quarter data?
We typically get it the second week of the month following the deadline. So the second week of October is when I start pestering folks to get it.
That's when we'll have Q3. Okay. All right. Great. All right. Thanks very much. Appreciate it.
Sure thing.
Yeah, I would be very interested in seeing Q3 specifically for B&Bs. I was very surprised at the extent of the drop off for B&Bs, particularly from, anecdotal input from at least Airbnb. From June on, there's been a tremendous uptick in rentals, and a drop down to just under 3,000 was a bit shocking. So I'm wondering if there's any way of rectifying for those that the tax is not collected automatically. If there is some at the end of the year adjustments, if people, for the VRBO and the others where it's not collected automatically.
I'm not sure. Taxes are paid following occupancy, so I'm not sure what you mean for rectifying in that case.
Yeah, I was specifically thinking the room tax that's collected for Airbnb that's not automatically collected for the others.
Those individual hosts are responsible for their own tax filing and payment. So I don't believe there's any reconciliation unless they present a case to finance that they've overpaid. I know there was at least one case of that early in the about 6 months ago, maybe a little less than that. The one property had actually collected the hotel tax and remitted it in advance, and they had all of their commencement related business canceled, and they were able to reconcile that. But except for those unusual circumstances where somebody's prepaid, there won't be any reconciliation.
Got it. Another quick question about ACOD specifically. Many of the organizations in ACOD or that receive grants are provide a service that is not really transferable into a virtual environment. and can't really re-engage until we have sufficiently distributed a vaccine, essentially. But once we do, they will probably want to get up and going. So they would need to apply this year. But what are we going to do? What's the assessment for those who essentially are furloughed until that point, which may come next year? I don't know if you understand my question, but
I think I know where you're. So yeah, this is going to be a very unusual year in terms of evaluating grant applications for ACOD. Typically, it's a relatively apples to apples comparison between, various artistic or cultural organizations to understand things like attendance and audience size and how are they engaging, what's the engagement with their look like, and how many performances they hold, things like that. Clearly, most of the organizations, in fact, all of the organizations that have or current recipients of ACOD have not been able to engage their audiences in that way. So I'm working closely with Megan Barber and looking at what questions we have in our application and how we want to modify those to make sure that we're collecting relevant information the committee can use to evaluate how the organizations are actually making it through the situation, and what their plans are for the following year, for 2021. That's, I think we're right now at the point, we see that there is value in having some virtual production, that we wouldn't necessarily see value in funding an organization that was going to do no performance, no activity in the coming year, because that doesn't really enhance our cultural brand as a community, and that's really the purpose of the grant. Understanding that it's very difficult and that it's a really challenging proposition, and that it's not a level playing field out there on the online space. So.
Okay, thanks. And the ACOD grant is the only grant that we're continuing. The others will continue to be suspended. Is that what I'm seeing?
That's accurate. Yeah, the budget suspended all of their grant programs.
All right. I just want to make sure everybody understands that. That was my last question. Nick, thank you. I know you've got your hands full. And thank you for your continued updates. So moving on to Tompkins County Area Development, we do have a report in our packet, one-page report. I don't see anyone from TCAT to answer any questions we might have. I do see one phone number, Katrina, that I don't recognize. Oh, is that Dwight? Got it. So Dwight is on the phone and on the video separately. So that'll be a little awkward, but I'm sure we'll make it work. But we can hear you through the phone. Is that ultimately we will be able to? That's good to know. There was one thing I did want to point out in the TCAT application. So I sit on the board for TCAT, as does Mike Sigler. I don't know if Mike, you had anything that you wanted to add. I did want to point out, they do talk about the ARC Power Grant for broadband. That is specifically to extend a wire that Southern Tier Network currently has going into Tompkins County. And I just wanted to clarify why they would have a wire already coming into Tompkins County if we are not one of the member counties. Several years ago, they got a state grant to do middle mile connections through Tioga and into Broome. And part of that grant was that they had to connect higher educational institutions within a certain mile radius of the project. And one of those included Cornell. So a wire comes through south from Tioga County up into Tompkins County and connects to the vet school at Cornell. So the ARC grant proposal was to extend that terminus up through the east side of Cayuga Lake and connect to the proposed data center in Lansing, which in effect would mean that that wire, middle mile wire, would extend almost to the northern border of Tompkins County. We will be hearing the results of that grant application imminently, I understand. It did score very highly, third in the country for this cycle. So we're all very hopeful. I can speak to that. Mike, did you have any other comments as another one of the liaisons to TCAT?
No, you covered it pretty well.
And I do want to know if anyone on this committee wants to be involved moving forward with any of the exploration and work with broadband, please let me know. Happy to include people, particularly from this committee, because that it seems that this is the right space for this because of its impact on economic development. So, and if there are no other comments from our economic development agency, or where we contract. Moving on to Dwight and transportation. We do have a resolution that I'll put on the table first. Authorization 2024-4, that's New York 2020-061. Federal Transit Administration Section 5307. Grant application for Tompkins Consolidated Area Transit Inc., TCAT, and Tompkins County. That's ID 9548. Can I have someone move that? Annie moves, Mike seconds. And Dwight, I don't know if this is one that you wanted to cover for us and give us a little bit of a summary.
Sure. Hello, everybody. Can you hear me?
Yeah, no, it works wonderfully.
Okay. I used the phone because the last time I had a meeting, somebody told me that my audio wasn't good. So this is my fallback. This is a regular standard federal transit funding grant. It pays for, as far as the county's concerned, for county work. It pays for my position, and the pays for 80% of my position, and the state pays for 5%. That's not in this grant. Other than that, there's a list of capital items for TCAT and a operating assistance for TCAT. But it's like a regular standard grant.
Yes, I've seen these that come in every year. So thank you, Dwight. Does anybody have any questions about this? One quick clarification, the federal grant, federal transit funds are just over 2 million. The cost of this whole project list is about 3.3 million, just under. Is that difference a local share?
No, well, the difference is non-federal. And so operating assistance is it's a 50-50 percent of federal and non-federal. So that largest differential that you see is operating assistance, and then primarily TCAT. TCAT funding, and there's also for capital, as I said before, it is 80% federal, and then I misspoke before, it's 10% state and 10% local, and all that local is from TCAT.
Okay. Yes, just the state part was very helpful. So it's 80, 10, and 10.
Yes.
Great, thank you. Unless there's any other questions, I'll move to a roll call. Martha?
Yes.
Annie?
Yes.
Henry?
Yes.
Mike?
Yes.
All right, that is unanimous for this. And Dwight, did you want to speak about the integrated mobility innovation demonstration program, Tompkins County, New York, the mobility as a service phase 1, multimodal trip planning, customer service, and first last mile public transit pilot summary you put in the agenda?
Absolutely. This is a new type of grant for us. We were exceptionally fortunate to be one of 25 in the country to receive this award. The legislature authorized our application last August. We've gone through this week, we actually completed the contract process with the FTA. It's a very different type of grant. We've never had anything like this before. This is a research, development, and demonstration grant. It's administered by FTA headquarters staff from Washington. Normally, all of our grant work is done through the regional staff in New York City. So I've been getting to virtually meet and work with the headquarters staff that got our contract that was actually awarded on Tuesday, executed on Tuesday in this federal fiscal year. That was a very important deadline. I'm now learning about all of the requirements for this grant, and it is fortunate that the FTA has provided adequate funding for a 2-year development and demonstration program. So their intent is for the first year to do your development work and your second year to do the pilot. FTA will hire a national level consulting group to do the final report. And what's very different that we've had, there's a number of things that are different we have not had to have before. One of them is that we need a data management plan. We had developed a data management plan that went in with the initial application, and now that since we have been awarded the funds, we need a real data management plan. We have some other requirements we haven't seen before, but we will receive technical assistance. This is a collaborative effort. It's a collaborative effort of TCAT and Gadabout and the Center for Community Transportation, which includes CarShare, 211, Go Ithaca, from Downtown Business Alliance, and Way to Go from Cornell Cooperative Extension. There's a lot of eyes on this project. We are one of few small urban rural areas in the country that's trying to do this. The other one I know of is in California, in the San Joaquin Valley, and they're trying to cover an enormous service area. We are looking to provide, for the first time, really support for information and support for people who come to work in our county other than driving alone. So people who are in carpool or vanpool, or they're taking a commuter bus from Chemung, Cortland, Schuyler counties. And we will also be providing support for people who live in Tompkins County, who work in other counties, who are getting there other than by driving alone. So this isn't the usual bill of fare. This is something different. It really, the FTA told us that one of the factors that what we proposed in terms of assisting people having a system and a membership program to assist people when they have trip failures was the creme de la resistance. That is why they gave us the award, because frankly, there's no other entity in the country that wants to take that on. So we pitched it and we got it. So now we have to figure out a good way to do it. But we're at the scale that I think it is very, very doable, and we have resources to work with. The last thing I will say is TCAT has their T-Connect service, which is operating now in the Lansing, Etna areas on the weekends. This was their first rollout of their, it was their last mile project that became a on-demand project. They developed an app. They will be reworking their app with more customer input to make it easier to use. And our role here is that we will support them with a second year of their pilot for $100,000. In exchange, we're able to use their NYSERDA funding as a source of our local match for the whole $820,000. So that's some of what we do when we do the grant planning work. But that really worked out very, very nice. So I will stop and entertain any questions people have, and we will have a very up-to-date website, and the first thing we will be creating are some extraordinarily short videos that explains all of these three elements, so people can understand what we're doing in, like, 3 one-minute videos. So I will stop and be happy to answer any questions people have.
I just wanted to add a couple things. I know all of us have been going through a tremendous amount of meetings, and I feel like we're all like getting not as much sleep as we should be, and they're all bleeding into each other. I know for myself, I've had feel like about 12 meetings a day. So I just want to acknowledge and appreciate everybody for sticking with all of the various things, because there's so much information and it's so disparate. But I do actually just want to say to Dwight, I know you've been working on this for years. Sometimes we can get lost in trying to understand a lot of the details and following, because you know so much about this. But I did want to just bring to everybody's attention how much Dwight has been working on mobility as a service and what mobility as a service actually means. Honestly, I think it's one of the coolest things that I've heard of in the transportation world in the last 10 years. So I kind of just want to light a fire under everybody. One of the biggest issues that we face in Tompkins County is the fact that we have a very urban and a very rural environment simultaneously, which makes transportation, and particularly public transportation, really hard. And we all know that we have a situation where, housing costs are escalating, and affordability tends to coincide with living further and further out of urban centers, which even exacerbates this problem. So there was a white paper when I first got onto the legislature that was published about our Office of the Aging. A super cool paper highlighting how wonderful Tompkins County is. It was a national publication specifically to address the needs of transportation for our aging population. And how to help them get to their doctor's appointments, get to pharmacy, get to any of the needs that they have, shopping, and how to integrate all the different types of public transportation so that maybe one might not meet their needs, but they could take 2 or 3. That is extremely difficult to coordinate, and so most people don't do it. The idea of mobility as a service is that it coordinates all the different types of public transportation into one platform ideally, which is a phenomenal innovation. So just keep your eyes open, because I actually think this is really cool. The fact that Tompkins County has been highlighted, we have been consistently highlighted, and specifically because of Dwight's work on this. So just keep your eyes open for where the county takes this. And if, Dwight, you are able to ultimately develop an app that is highly functional and ideally ultimately integrates the payment process, which I know is the biggest sticking point, that would be amazing. I think amazing not just for Tompkins County, but actually as a model throughout the country. So really, everyone, it's bigger than Dwight lets on. So I just wanted to make that clear to everyone. And I see that Annie has a question.
Thanks. It's not really a question, but I just wanted to say, Dwight, thanks for all your work on this. As we have more people, that used to retire, say down in Florida or down south, when I'm talking to people, we're definitely getting more people in the area that want to stay here for various reasons. And
Right.
So mobility is such a key factor. So thank you very much.
Thank you.
I see, Martha, you have a question as well.
Yeah, thanks. And this is exciting, Dwight. Apologies if you hear some funny noises. We got work going on in the house. So a call center is, now, this is a 2-year grant. Are we going to be contracting with, and it says you're evaluating model call centers in counties in New York. Is this something where we would be contracting with a service for a year or two? What are the upfront costs and what happens following that once the grant runs out?
Those are all questions that we will be dealing with. I will say that we will be looking how we can incrementally use existing local services. And so we're working with 211. We're working with Ithaca Car Share. Those are both 24/7. And with Ithaca Car Share, it has to be, because stuff happens. And we will be developing an app that will include everything but payment. And because we anticipate that half people will find using an app very friendly, and half people will want to call and talk with a human. That's also different than what other larger mobility as a service platforms do. Other platforms have no way to call anybody. They don't even list their phone number. If you're not tech savvy and young and have credit, you're not their market. But coming from a social services background, we're very much aware of who we need to have, who we will be working with, and the customers we need to serve. So we're going to have both. We have a period of time. We have 12 months to really develop and refine and deal with these questions. We are very much concerned for sustainability within the resources that we have coming into the county. So, you know, to quote somebody who described Tompkins County and Ithaca to me many, many years ago, we have champagne taste and a beer budget. So we know we have a beer budget, so we will make it work.
I'm sure you will. All right, thank you very much.
Thank you.
Thank you so much, Dwight, for all of your work on this. I'm super excited to see where it goes. Truly.
Oh,
this is awesome.
We all are, and we'll provide a very timely feedback reporting with the committee. And not only that, we will really try to have a very innovative, accessible process that people have access to whenever they would like online for the development process. But we need to be really, really, really accessible. And matter of fact, one of the plans we need to do is a equity and accessibility plan. And when we have that done, I'd be very, very, I will definitely share it with you all.
That's brilliant. Thank you so much.
Okay, thank you.
Take care.
Yep, bye-bye now.
Before Dwight goes,
Oh,
Dwight?
yep. Penny?
Yep.
Since we have a new Chief Equity and Diversity Officer, if you want any help on your equity plan, I'm sure she mentioned she wanted to make sure she was available to help out in any way to our partner agencies.
Great, because yes, I do need help. I'm saying yes to everybody.
Well, she has definitely the
Okay.
energy and certainly the experience to help out.
Yeah, her name is Deanna Carithers. And she's in our administration office with Jason.
Okay, great. Thank you. Thank you so much.
Absolutely. Take care, Dwight.
Okay,
So we
take care.
have-
Bye-bye.
Bye. I just want to note, we don't need to vote on it, but we do have a budget adjustment and transfer, and this is for Workforce Development Board. That's a budget transfer for computer equipment, ID 9556. Again, that is just for your information. Before leading into our final presentation or update from our lovely Natalie. From Workforce Development, our Workforce Development Board Director. Welcome, Natalie.
Hi, Anna. Hi, everyone. That's very kind. Thank you. You know, you mentioned earlier 12 hours of calls, and I have to say the concept of time has eluded us here. So you had a confusing series of emails from me on Tuesday earlier, and I thought it was Thursday. So we're trying to move. We're trying to move on from that kind of scheduling here.
Well, one of the things I've been telling people, we've lost our 5-day work week. Wasn't there a law that said we weren't supposed to work more? I can't tell you how many emails I get at 11 or 12. I keep thinking if I send it late enough, I won't get a response for 8 hours. And that doesn't happen at 2 o'clock in the morning. I wake up at 7 o'clock in the morning and everybody's responded already to an email. I'm thinking, come on, y'all. I think we're all trying to one-up each other. Stay up later. Yeah. So we're the last person to respond to email.
Right. Well, we're on a 24-hour day here. Absolutely.
Exactly. Well, thank you for being here.
Yes, of course. I'll give you a brief overview. And I have to say, hearing from Nick earlier, talking about tourism and hotels just makes me want to jump on a plane and visit somewhere. But how lucky we are to be here in Tompkins County and to have so much available to us. You know, We at Workforce Development, as connected to the state, are making a shift. So all the workforce development boards presented to the New York State Department of Labor yesterday on how we have continued to the best of our ability to provide services locally to both businesses and to residents. And we sort of like fed into that process. The New York State Department of Labor is now turning, they have repurposed everyone, as you know, to work on unemployment insurance, which, you know, still has issues. But the focus now is very much on trying to get people reemployed, whether that's at their previous jobs or new ones, and also developing a virtual platform to make accessibility better for everyone. We are awaiting that. We expect that to arrive middle of October. So that's good news. Our Career Center still is not open to the public, and that too is a state decision. So I will just remind everyone of the phone number here. We want to hear from you. We're at 272-7570. Please call us, listen to the message, the greeting, leave your details, your name and your phone number. We're guaranteeing a phone call back within 24 hours. Some other things that are happening here, just a big picture. We are developing an employment and skills strategy for 2021. And you've heard me say previously that if we were doing this the right way, we would be thinking about 5 to 10 years out. Given the uncertainty of the moment and actually what training will look like, we're planning for the next 12 months. Our previous workforce strategy is from 2008. So we think now is the time. And we're using the words employment and skills because those are things we very much want to measure for everyone. I really want to share with you, we had the Workforce Development Board met on Tuesday morning. And so this is 26 members of our community, businesses, social enterprises, nonprofits, all of our agencies. And the request was that we start the meeting and just take a good amount of time and share with one another what's working in terms of keeping up the spirits of employees and businesses. And I have to tell you how cathartic this was. If you're interested, I'm happy to email you all with some of the responses, but I think that we are in a new dynamic, if you like, between employees and employers. We are all being more thoughtful about things like celebrating birthdays and about leaving Post-it notes on one another's computers if we're in the office, or thinking differently about lunchtime and sharing a meal together if we're on the shop floor, and how we can do that and keep one another motivated during this time. So I just wanted to let you know that those kinds of conversations are happening, and that was really good to hear. One other thing I want to tell you about as we continue to understand how home and work and learning are changing in this moment and into the future. As part of that employment and skills strategy I mentioned earlier, we're also going to be designing a skills map. And this is where I continue to use some travel language. We're going to be looking at as many of our key industries here in the county as possible. This is going to be a very in-depth piece of research. We're going to be interviewing as many employers as possible to understand how their skills needs have changed since this time last year. So with the understanding that we're not going back to an identical economy of January 2020, and that things have evolved since then, And we really want to get an understanding of how all of our businesses, and that's anyone who has a workforce, is understanding the next 12 months. What are the skills that you need? And then on the availability side, we're waiting to hear about a methodology about how we measure the skills that are available in the county. That will then help us. That'll, not just give us a map, but I hope a backpack and a compass, and we're going to put some mileage markers in place, if you like, and we're going to be able to measure where we put a very much reduced budget in terms of skills and training. And so I should be able to tell you more next time we meet. We're excited about that. And also, let me just say too, if you're out and about and stretching your legs, do stop in and see us here. We have our Career Center is completing on September 30th the Summer Youth Employment Program. We were able to put 100 young people to work with very willing employers this year. We hosted one here at the Workforce Development Board, a young artist. We felt we needed some inspiration. And so we have a beautiful new canvas here that we'd love for you to see. The canvas was done in connection with TCAT and Visit Ithaca. And so we have an original painting that highlights the covered bridge at Newfield and hot air balloons and several falls and Cornell University. So come see our original painting. And I think that's everything from me this time.
Wonderful. I want to first go to committee members to see if you have any questions. Annie?
Thank you for the presentation, Natalie. So I think it was Anna that, or maybe it was you that gave us numbers before on overall unemployment for the county. Do you have those numbers?
Yes, and actually I see Henry on the call too, who knows I owe him an email because he dutifully checks in with me on a weekly basis on this question. So thank you for asking. Yes, our highlight numbers are here in the Ithaca Metropolitan Statistical Area, which is our local MSA, which is Tompkins County. We are still at 9.9% in terms of our unemployment rate. I'm saying 10. You've likely heard me say before, and we watch these numbers every week. Since the middle of March, which were those original executive orders about the stay-at-home workforce, we know that over 10,000 people have accessed unemployment insurance here. Now, that could be the traditional unemployment insurance. That could be, and that is the top up, that was the pandemic unemployment assistance, which was $600 a week and is now $300 a week. And then the new unemployment insurance program, which allowed traditionally unqualified workers to draw down a payment, which includes sole proprietors, contracted employees, and gig workers. So 10,000 is a substantial number. And just to put that in comparison to this time last year, our average weekly initial claims were between 30 and 50 people. And I have to say that that's even during a time when, we were looking at the close of the season. So those would have been like seasonal adjustments. Our high point during all of this was 1,400 people weekly. We are now, I've been asked if we're sort of flattening the curve. My response is that we still have a bit of a wiggly line. And so we're seeing around 150 new claims a week, but we also know there's a story about people returning to work at the same time. And so there is still a lot of movement in our labor market. I've heard a wonderful new idea yesterday about a drive-through career fair. And how cool this is. I think we need a very big parking lot. And the idea is to bring an event that normally might have happened at a conference center or in a high school gym outside. And so this worked well in Broome and Tioga, and we're taking some notes from them to see if we might do something like that. And that is really an organized parking lot with the same kind of sort of conference structures and tents and discussions where people interested in employment and sharing their resume drive up in their car and talk to potential employers, and some people are getting hired on the spot. So that's an idea we're exploring here.
Please give Buttercup our love, Annie.
Thank
I
you.
just had to add that in.
She doesn't like morning meetings because I'm taking her for walks. She goes on a leash, so she's a little upset, but I have a morning meeting.
Well, we'll try to be efficient. But thank you, Natalie. I had a question, just an observation, some of the things that I've been hearing, that the unemployment claims, at least the phone lines, there's been a huge uptick in the last week to week and a half at the state, to the point where you previously could wait for 2 hours and eventually get someone. And now the system is simply, we are overloaded, call back later, and it will hang up on you. So, just curious what is going on, if you've heard anything, if the reduction from 600 to 300 has caused a big impact, what the ramifications of that has been. So I'm just curious if you've heard any.
Yes, we have heard this. We think that there's a combination of three things happening. So the pandemic unemployment assistance changing from $600 a week to $300 a week. There hasn't been a lot of communication about how that takes place. And I just want to say for everyone that if you were already eligible and receiving, you don't have to do anything. Your payment will simply change from 600 to 300. So that's one source of the calls. The second source of the calls, I think, again, is this moment of adjustment that we're in. As people return to work, they may not be at work at their full hours, and therefore they are still eligible for a partial claim. So there are lots of questions around that. And that's from both workers and employers. So for example, if your job was a 40-hour-a-week job, you're only being called back for 20, you're still eligible to make that unemployment insurance claim for the remaining 20 that were lost or that haven't been returned to you.
Unless you work 4 days a week.
Yes, so there's that threshold there.
So if you work for 5 minutes on a day, that is considered a full work day, just so people understand that.
Yes. Different from other measurements of work, but yes, for just this system. And so I think that there are a lot of questions around that. There are still a large number of incomplete claims, of duplicate claims, of claims that according to DOL should never have been made. And so there's still a large team there trying to sort all of that out. But the team working on unemployment insurance is getting smaller.
What's just the worst part about it. And just one last question, if the Workforce Development Board could maybe, and I don't know if this is possible, but this has extended to gig economy workers and sole proprietors. But I don't think that people understand the extent of the difficulty in actually obtaining it, that you get, you do the initial application, which can take 8 to 10 hours on the phone to do that entire process. And then you have to subsequently, you'll get a letter saying you need to send Social Security and a birth certificate and driver's license. If you don't do it within 10 days, they will terminate your application. And then from another office, you'll get a list of, you need to give the last 3 years of your taxes and was the other, and profit and loss sheet. And, oh, we need that in 7 days from the day that we sent it. And if you don't send it within 7 days, your application will be canceled. And on and on and on and on. It's a very different process for sole proprietors. And there's really no assistance or sort of information. Have you gotten calls from sole proprietors? Do you have anything on your website to clarify that for sole proprietors? Because it's quite a difficult, arduous process. And I suspect that a lot of the incompletes are from them.
It is a very tricky process and should have been made a lot easier. We are taking as many calls as we can. So we just encourage people to call and ask us. We know who to connect you with at the Department of Labor. I think that throughout all of this, I think expediency could have been a lot better from all of the partners involved. And all I can say is that, you know, we are here to help. I think that another thing that this has revealed for us as a county is that we don't entirely have a good picture of how many gig economy workers we have. And I think that this has showed us a lot about the proportion of our economy that is actually attributable to people who don't have a 40-hour work week with healthcare benefits and with a retirement plan. That's sort of the bigger picture. That's what we're seeing here at the board. But we'd be very happy to get together a list of websites that can best answer questions for that group of workers. And I can send that over to you, and we can make sure it's posted on the Career Center website as well.
Yeah, I think that would be super helpful because there are so many people that I know. It is the new trend of people who have 3, 4, 5 jobs and they cobble together. That's the nature of the new economy that we know about. And so I think that would be hugely helpful. And I know you are all talking across the state. And another thing that I think is poorly done is the 4-day, that you can work an hour a day for 4 days. And even though you're working under 10 hours, you are not eligible for unemployment. And that's a travesty. And I've heard that as well. If you happen to be lucky and you work your 20 hours in a 2-day period, you will get paid for those other 2 days. If you have 10 hours and it covers 3 days, you'll be eligible, but you will only be considered to have not worked for 1 day. And so, it's very antiquated based off of an old 9-to-5, 5 days a week work week.
This is very true. And like you say, this particularly affects those contracted workers, whether you're on site or whether you're working from home. And we need to have a much better understanding of what all of this looks like, going into next year. So yes, I'm very much taking your concerns on board. We will communicate that both to the board and to the state. Like I said, we'll see if we can gather some resources that provide more information for this group.
Thank you, Natalie. I very much appreciate it. I know everybody's working really hard. So I see Martha has her hand up.
Yeah, thanks. I would point out this is the first time independent contractors and gig workers have been eligible for unemployment at all. So things are, everything takes a while to work out the kinks. Natalie, you mentioned $300. I thought it was supposed to be $400 with $100 pitched in by the state.
So that's what we understood originally as well. There was a lot of toing and froing on this. The $300 is actually paid out of FEMA. So there are different federal structures that are making up this money. I as much as I understand, something happened along the way. So the $300 is a federal decision. And the state of New York had to apply to FEMA in order to get that approved, which took some time. So for a while, we weren't able to say anything. I too had originally seen 400, but the advice that we heard, or the reality that we heard yesterday, and the New York State Department of Labor website and all of their social media has announced 300. So that's what we're communicating here.
Well, that's interesting because, you know, that was the president's executive order was it was going to be 400 and that he was giving. And then we heard, oh, wait, it's actually 300 from FEMA. And the states have to, in order for their residents to get that 300, they have to also pitch in 100. So, all right. I wanted to just touch base about something Jason mentioned earlier. I'm not sure you were on the call, that Cornell is already starting, and maybe ICL are already starting to plan for a safe exit from the community and entry in late winter. So I know we always have a big drop off, a lot of people on unemployment during the winter break, you know, cafeteria people, cleaners, et cetera. So this looks like that break is going to be, say, before Thanksgiving to, I'm not sure when Cornell would be coming back, but so that's a bigger chunk of time. Are you thinking ahead about that? Is there anything in particular that we ought to be planning for that might be unique in this community?
Yeah, so the Workforce Development Board meeting on Tuesday morning has been highlighting an industry briefing every month. So previously we've done hospitality. Last month we had healthcare. This month was education. So we heard from Cornell, Ithaca College, and TST BOCES. And we wanted to hear about this from a workforce perspective, not to sort of get into another essential but very frequent conversations that we've had here as a community about, well, what's happening with students? So we actually talked quite a bit about the workforce impact. And so Cornell has not had a large number of permanent furloughs, which is good news. We do now understand that the semester is going to be broken into two. And I believe the second half of this semester starts second week of October, I think is the split. So I am very glad that you've asked this question because we do anticipate that that's going to have an impact. I do not know how to measure that. But the only way we have at the moment, and believe me, we have looked at every number possible, is to look at the unemployment rate and the claims rate. The claims rate, or the number of claims, the real number, is at least 2 weeks behind. And that is the most recent number we can get. When we look at our unemployment when we look at our unemployment rate, we're looking at something that happened 2 months ago. And that, reflects the nature of this moment that we're in. If we had more real-time data, believe me, I would have it in my hands.
Yeah, I'm kind of, I guess I'm putting a pin in, maybe we should start talking to Cornell about which employees might have that more extended. They might have, it's an annual thing that happens, but this time it might be an extra 2 whole months or something. So maybe that's a question I can pose to DSS and see if other people are planning ahead for that.
Okay.
Okay, thanks. Thanks,
Thank
Natalie.
you. Good to know.
Thank you, Natalie.
Sure. Two more quick things, if I could. Speaking of Cornell, we are about to host 2 interns from Cornell's ILR school, which we're really excited about. They'll be receiving credit for being based with us here at the Workforce Development Board. Both of them have local roots. And so one young man's dad grew up here in Tompkins County. And the other is from actually New York City. Together, they're going to be looking at two really important components of an employment and skills strategy. The one is the equity, inclusion, and justice agenda, and the other is the transition to a green economy. And so we're going to have some really interesting local writing here. We're bringing together all of our community partners to do that. And so this employment and skills strategy for 2021 really is going to be written by all of us locally.
And when are you planning to have that strategy complete?
Well, I would like to have that ready to launch in January. So we're moving lots of pieces at the moment.
It'll be wonderful to see it when it's complete.
Okay, so yeah, keep asking.
Annie?
I was just, Natalie, I don't know if you heard what I said to Dwight when he was on the call about our Chief Equity and Diversity Officer.
Yes, Deanna. So yes, we've reached out to her.
Great.
And we are, as you know, finally going to be hiring a deputy here. And so I really much want to seek her guidance on how to do that.
Okay,
So-
great. And I'm glad you're going to be finally getting the deputy. It's a long time coming since before you started, probably. Yeah.
Yes, indeed. We actually wanted to amend the job description because so much has changed. And we want to make sure we find the right person for this new economy that we're in. So
Great. Thank you for reaching out to her. She's wonderful.
yeah.
And good luck to you. And thank you for all the great work you're doing.
Thanks, everybody. If you don't mind, I'll communicate that to our Career Center as well.
Please do. Do you have any sense from the state when they might possibly allow the Career Center to be open to the public?
No.
Okay, that answers that question. Thank you. That was my last question. And really, please do tell everybody thank you so much for the
We
continued work.
will. We will. Thanks, everyone.
Wonderful, thank you.
Bye.
So that is the last agenda item. We've gotten some very thorough presentations today. I very much appreciate that everybody stuck it out for the full 2 hours because I think this information was really important, covering housing, tourism, broadband, workforce. We've covered a lot of ground, tech, transportation tech. So thank you. Unless anybody else has any comments, I would love to move to adjourn this meeting for the month. Can I have a universal second? Lovely. That is everybody's hands. I'm assuming Henry as well. Take care, everyone.
Take care. Have a good
Thank you,
afternoon.
Anna.